In this room, there are a number of people who've had to deal with the consequences of cell phones, and I want to just make something clear to you. While in most of the studies it's been 10 years of heavy use before we see a statistically significant increased risk, in Sweden there have been a few studies that have found that people who start to use cell phones at younger years, before age 20, have 4 to 5 times the risk of malignant tumors of the brain with less than 10 years. And heavy exposure can cause brain cancer in less than 10 years. So it's not just the amount of time, it's the amount of exposure. And unfortunately, we are seeing growing reports of people who have been very, very heavy users of cell phone, many of whom never dreamed that what they were doing with that device, which helped them grow their business and succeed in life, could end up to be threatening their health. I'm going to ask Ellie Marks, who has been working with Environmental Health Trust, to introduce a few people who are here today and ask you just to make some brief remarks now about what this experience has been. And I think while Ellie's coming up, I'll ask if there are any general questions from the floor about the science that I've discussed today. I'd like to encourage that. Yes?
Hi, I'm actually a brain tumor survivor, so thank you for this work you're doing. I'm wondering, had 2 questions actually. The first is, are some earpieces safer than others? And the second question is, are cordless phones, are those,
right.
Is there any risk there that we should worry about?
The answer to the first question is I don't know, but I think some earpieces are safer than others. But any earpiece is going to substantially reduce your exposure. An earpiece with a hollow tube is going to be better. There are technologies out there that do reduce radiation to the brain. I'm not an expert on which ones are the best right now, but any headset will substantially reduce your exposure. All right? Cordless phones are like small base stations. They are constantly emitting that radiation, from the microwave radiation from the base station. The Israeli government website last month issued a warning advising people not to use cordless phones. Please get them out of your bedroom. Certainly don't have anything like that near your head. Thank you.
This is a related question, Dr. Sandy Ross, Health and Habitat. Smart meters are going in all over the United States, and they send pulsed microwave messages up to several times a minute. Have you had a chance to look at this, and what should we do about it?
Okay. I have not looked at it, but it's clear that we do not have a lot of information about this, and other nations are not using this technology to monitor electricity. They are using fiber optic cables. They are not using 24/7 pulsed monitoring. And I think we need to learn a little bit from our colleagues. Why are other nations not doing this? And I think we ought to have more of a national conversation on these issues, although I have not evaluated this in any detail. Yes.
Two-part question. Part one, are there any links between cell phones or wireless and bipolar manic depressive disorder? Second part of the question, are there supplements or herbs that anyone knows about with which we can protect ourselves? Maybe alpha-lipoic acid, turmeric, rosmarinic acid.
All right.
From all the wireless that's surrounding us.
There needs to be research on a lot of these questions. It would not surprise some scientists who work particularly in Russia and Greece, where they are looking at impact on mental health, to see an impact on the brain, but not that I know of. However, there are studies, cell culture studies, that have taken nutritional supplements and they do reverse or repair the damage. And that's why this message is so important. Even if you've been using a cell phone heavily up till now, take the phone out of your pocket, change your patterns of use a headset, and eat healthy things, and perhaps some nutritional supplements may help. We need the research to confirm it, but cell culture studies have shown repair of damage with some of the compounds that you mentioned and some others. Thanks.
Thank you.
Please identify yourself.
Yes. I read some articles a few...
I'm sorry, your name and where you're
Karina. I read some articles a few years ago written by chiropractors and nutritionists, I think, that even 6 feet away or more you can be affected, and it can affect organs, not only the brain. And I used to move away from them, but it's impossible now. And from cell phone towers you get a lot. They're in the atmosphere, so I don't think just having it next to your head, and I don't even have one, is
You're raising an issue that I am not an expert in, that will be discussed in the meeting that there's going to be held here November 18th, the issue of electrical hypersensitivity. There are some people who reportedly are sensitive to electricity. The reason I wrote my book, Disconnect, was because I do think it's very clear that nobody should be holding a microwave radio next to their brain for hours a day. And if people are more sensitive, like the former director of the World Health Organization was, then they need to take special precautions. And we need to have a much more informed discussion on those issues. Thank you.
And they also mentioned there were like oval devices, I think.
Yeah,
called ceramic ladybugs.
There may well be devices. I can't comment on which ones do or don't work. Right? But that's again, why should I be responsible for that? Isn't that the job of the government? Shouldn't we have major funding to answer those kinds of questions?
My name is Liz Mankus from Walnut Creek. My question is, I've heard from people that the actual food itself that's heated in a microwave cannot be healthy. Is that a myth or is that true?
I know of no reason that that's true.
Thank you.
I'm Bill Allio with the Environmental Working Group. We were co-sponsors, or the sponsor of Mark Leno's cell phone right to know bill in Sacramento. My question is, first I want to say on microwaves, I looked it up for myself. Some foods, the vitamins are diminished by microwave cooking. I had a debate with someone on this. I looked it up. So
yeah. Thank you. I'm sure that vitamins are affected by cooking, a lot of cooking. I'm not sure they're worsened more by microwave than other cooking.
According to the studies I read, they are.
All right.
Certain
well, then
foods.
you may.
The question is, you said early on that you'll differentiate or show us why non-heating rays are bad for the brain. I've been told these studies will it heat the brain cells? Can you elaborate a little on that?
Yeah, no, there is no heat in these studies. In fact, let me say this. There's no measurable change in temperature because, after all, heat is nothing but molecules moving faster. These effects are occurring at levels where there's no reason to think there would be a change in temperature. It's not a temperature-related phenomenon at all. The theory is it's like resonance. If you take a rubber band and you snap it once, it's fine. But if you keep snapping it and you snap it in an erratic pattern, you will eventually get it to break. So we don't really know exactly what's going on here, but the studies repeatedly do show that damage is occurring with the pulse signal. If you're riding in a bus or a plane, it's kind of vibrating like this, and you can read or write because it's this nice steady movement, right? But if it suddenly stops and starts again or lurches, you get thrown off balance. That may be more like what digital signals are doing, not through the heating mechanism. And there's quite a large discussion of this. I'd be happy to share it with you. And some of it, actually, we just put up yesterday on our website the latest references on this from 2010, in the past 4 months, on exactly this phenomenon. It's a very complicated issue. None of the research is being done in the United States on this, and almost nobody in this country has training to evaluate this. I've only been working on this for 6 years. There are people who've been studying this for 30 years. And they're generally marginalized because the industry has succeeded in boxing us out of a really informed public discussion. This is a very important topic. And I need some guidance here about time because we're, all right, go ahead.
Hi, I'm Kristen Ryder from Alamo, and my 11-year-old does not have a phone. She's one of the few that doesn't. But I believe that what you're saying is important, and the addictive I teach at her school about addictive habits too, and there are studies that show that their grades, it takes like 25 minutes if you answer a text to get back to where you were in your studies, and that grades are declined in kids who are texting, etc.
Yes, and I fully agree with you that we've got to work with parents and teachers, and that's what we're doing. In Jackson Hole, Wyoming, we have a program working with young parents to educate and train them so that they understand that you don't want to give your child a phone to play with. You've all seen parents who take the one fish, two fish and give the kid the phone and it's connected to the wireless the whole time, or they'll download an app for white noise and put it under the kid's pillow. We think that's a bad idea, and those things would be illegal in France.
So I did, my chiropractors, I have 2 different ones. Both of them had those little devices, and I've got one on my phone, and they had them all over their offices, on everything. I don't know if they work or not, but you said you hadn't seen whether or not these like BioPro, these little things cut down the radiation.
Again, I think it's really important that we figure all of this out. It's really important that we do that, right? I just don't have an answer to those things right now. And I think I'm confident that American business will be able to solve this problem. I really am.
My last question is it more severe radiation from laptops and iPads?
Yes, we need to know what the answer to your question. The last segment of my book talks about new business. It talks about the fact that there are tremendous opportunities for business here. And I think there are. And I think we will soon realize those. But that's not what I'm doing. I want to warn people about the current patterns and current dangers.
But iPads and laptops are more severe
radiation. They have much more radiation, but you don't hold them next to your head. Okay. However, you don't want to keep them right over your gonads. And if you read the iPad warning, which nobody does, it says, hold it away from the body. And yet you see everybody holding it right on the body. Yeah, there's even a syndrome of irritation to the skin that's been reported in dermatology now from people who keep their laptops constantly on their body. They get a permanently kind of tinged skin from it. Right? Go ahead.
I'm Abby Ridgway from the University of Berkeley School of Public Health. And I was wondering if you could talk about, given the increased proliferation of cell phone use, have we seen an epidemic of brain tumors in the United States? And if so, why not?
That's a very important question. Have we seen an epidemic of brain cancer? And if not, why not? No, we do not have an epidemic of brain cancer. Thank you for your question. It's a really important one. The reason we don't is, as I showed you before, the latency for brain cancer in the general population could be as long as 40 years. We are seeing increased brain cancer sometimes after 5 or 6 years of heavy use. Heavy use in the United States has only taken place in the last 5 years overall for the population. 10 years ago, about 20% of Americans regularly used a cell phone, and they used it for less than half hour a day, 10 years ago. Now, the average use of the cell phone has skyrocketed, and it's all of us. So that's why we have not seen an increase in brain cancer in the general population. However, we are seeing an increase in young people. And as Dr. Ridgway showed you, in Israel, the Israeli Dental Association is sufficiently concerned that they have issued a warning about what cell phone use can mean for the young. Because the younger you are when you start with heavier use, the more likely it is that you're going to see a worse effect sooner. So thank you very much. All right. Okay.
Cynthia Jean Lee, a retired family medicine physician. Some people in the alternative health movements have expressed concern about aspartame and maybe some of the other chemicals being added to our food. And do you think that this might be a confounding influence between studies in the United States and other countries?
Absolutely. I think that aspartame is a very questionable compound. In my book, The Secret History of War on Cancer, I document how it was never adequately tested for safety. Sound familiar? Lack of adequate safety testing, and it was put into widespread use without that testing. In fact, the companies are moving away from it because recent studies have found an increase in cancer in animals when exposed to aspartame, and the increase is worse when the animals are exposed throughout their lifetimes, as many of us are now.
Bob Dameron, actually, for many years, but I have a little different twist on it. You probably wouldn't expect this question in your book, Disconnect. Well, it's a number of people, I don't know about this audience, but in California, Senate Bill 1375, I believe it might have been signed by Governor Schwarzenegger, what it would do, it gives the phone companies like AT&T the right to disconnect. If you don't have normal live service, you still have to, by law, be connected to 911. And it gives the phone companies the right to, if I believe it did pass, for phone companies to disconnect with 90-day notice. Anybody, if they don't have, if they're using a cell phone and they still have access to 911 emergency service. And I'm wondering if this is the way to kind of entrench cell phones into the psyche by eventually getting rid of landlines or landlines. They are landlines too.
Yeah, very, very interesting question. I don't know.
Right.
All right, we'll have one last comment, and then I think we'll go to Ellie.
I would like to know about those animal studies you were talking about and human studies. Are there more than just the ones that you mentioned or what you mentioned on there?
Yeah.
And what are they?
Right. Our website, environmentalhealthtrust.org, includes extensive references to the latest animal studies, and there are many of them. And the difficulty is there's not a lot of institutional funding and support for those. That's the problem. That's why when I testified before the Senate in September, I called for a $1 a phone fee to create a major program of independent research that would involve training. You will hear doctors, like Dr. Adele, saying, oh, it's impossible, there cannot be any effect of cell phones on health. That's silly. Well, he's been trained, as I was, in the dominant physics paradigm that said it was impossible, and he's mistaken. The lack of training in electrical engineering and in science and engineering in general in this country is appalling, and we have to remedy that so that we can have a more intelligent and informed discussion. I don't think cell phones are going to go away. They are very valuable devices. They've revolutionized medicine. They've revolutionized our ability to respond to emergencies. They've revolutionized trade in developing countries. But people have a right to know that cell phones are small microwave radios, and that if the companies are giving you fine print warnings now, telling you you shouldn't hold it directly on the body, we have to ask why are they giving us those warnings, and I think the answer is pretty clear, but I really would like to hear from them if any of them is here. Yes?
My name is Brett Boca. I would like to, shed some light on one of the questions about why there hasn't been an exponential increase in brain tumors. I was an early adopter. I'm a brain tumor survivor. I was an early adopter of cell phones in 1988. I've been using the cell phone as a primary phone since then. And it's taken me that long until I collapsed in the shower with a seizure in May of last year. So the latency period clearly is in excess of 20 years, at least in my case. And I was a heavy user, probably because I was in commercial real estate. And the bad news is that I had a brain tumor. The good news is that I happen to be a lawyer. And I'm going after the cell phone industry now with guns blazing. And you will be hearing from us at the CTIA and their whole gang as well. Soon enough, okay? Thank you.
Thank you for your comment. I'm happy to talk with you afterwards, but I think to move things on right now, I want to ask Ellie Marks to make a few remarks. And I know that there are a number of people who have come from around the country who are dealing with this, as this gentleman is. And it's really, really difficult. As Dr. Ridgway said, clinical case reports have often been the first indication we have in medicine that there's a problem. Whether fetal alcohol syndrome, the effects of tobacco on health, the effect of asbestos on health. Those first came from good clinical case reports. And unfortunately, we now have clinical case reports emerging on brain cancer, and we have an incredible wealth of experimental data, and we have human studies. And when you put all of that together, it's clear to me that cell phones do cause brain cancer, and we can avoid that risk by taking simple precautions, which is why I've written this book. I'm going to ask Ellie to introduce people who are here now, and then I think you plan to break afterwards and have a further press conference.
May I talk? I'm sensitive to radiation, so I want to tell you my experience. When you use earpiece, it doesn't help much because this radiation will go, it will go less to your brain, but it will go down to your internal organs, to affect your internal organs. Because I'm sensitive to
we are
that.
out of time. I apologize. Thank you. Well, first of all, I would personally like to thank Dr. Devra Davis for her courage, her commitment, and her intelligence involved in this issue. I became involved in this in May 2008 when my own husband, who's here with us today, thank God, was diagnosed the same week as Ted Kennedy. Alan had a grand mal seizure, as did Ted, and they were both diagnosed with a glioma. And our son had ironically worked for the senator and was the first to bring it to our attention months later. He said, Mom, they were both on their cell phones all the time. Long story short, we have confirmation from experts that Alan's glioma was attributed to his long-term cell phone use. He held it to the right side of his head for 20 years. The tumor is in his right side. I've testified to Congress. I've been on Larry King Live, many other national newscasts. That has brought me in contact with many wonderful people who are here with us today, who have traveled from quite far, and I want to take this opportunity to introduce them. First, we have Ginger and Craig Farver. Would you raise your hands or stand up, please? They're here from Fort Collins, Colorado, and unfortunately their son Rich died from this at age 29. His neurosurgeon told him it was his cell phone. Kristen Prishman is here from Chicago. Kristen's husband was 42. She has 2 little girls that I met when I was in Chicago this summer that are adorable. And unfortunately, he passed away last year from this. His neurosurgeon, Dr. Keith Black, down at Cedars-Sinai, also said cell phone. Mindy Brown is here with us from Fresno. Her husband, Dan Brown, was the Fresno State football coach, and he unfortunately also passed away from this. And Mindy has 6 children. And also, my friend Brett Bocook, who you just heard speak, was diagnosed about a year ago, and Brett called me and said, I want to sue those guys. And I said, wait a minute, let's get you into UCSF and take care of that tumor first, which they did, thank God. And Brett is just a fighter like the rest of us, and I just can't tell you how much I appreciate all of you being here with us, and I'm sorry for what you're all going through, and it's just heartbreaking, but we all want to help others so that they don't suffer as we have. And thank you all so much for being here today. I appreciate it. And there will be a press conference in a few minutes in the library right outside.